Hey you guys, welcome back. It's been a while since we've done a video. I was doing a class a few days ago, last week. I was doing a class, and while we were doing the class, while I was doing the class, some questions came up about Pavlik harnesses, and realized that on this YouTube channel we haven't gone over Pavlik harnesses. So I'm going to do a real quick demo video on your standard Pavlik harness. Before we get into the demo, the most important thing I can say to start off the video is Pavlik harnesses are typically, traditionally, and most commonly applied by a medical doctor, an orthopedic physician, orthopedic surgeon. They are not typically put on by nursing staff or technicians. There are people that will allow us, there are providers that will allow us to adjust them or to take a triage call, for example, from a parent in the case that one gets soiled or one gets damaged or that needs to be adjusted in the absence of the doctor. We'll go over that a little bit more. But today we're going to do a demo on how to properly apply a Pavlik harness, or in our case, what we want to look for if a parent contacts us in the absence of the doctor, the things we want to look for, and the things how we would fine tune or instruct the parent how to adjust in the event that they need that information. Again, I think that it's important that those of us on our level, the technician level, the nursing level, I think it's important that we know that we have the information. All in all, we will not be the ones initiating this, but it is good to know exactly what the provider has in mind so that you don't sound like you don't know what you're talking about. So we'll go ahead and get into that right now. So we moved over to the exam table. We have the harness. We have our baby doll. We have the actual package, which I'm going to talk about in just a moment, and we have a measuring tape. So a couple basics here, real basic Pavlik harness stuff. Why do the doctors apply Pavlik harnesses? Most common reasons for applying a Pavlik harness to an infant is called hip dysplasia, or I guess malformation or not complete formation of the acetabulum ball and joint socket, which the doctors will get into with the parents as to why they're applying it and how they're gonna place the harness in a specific position by their diagnosis, so that will allow this to start forming properly over the first 3 months of the infant's life. So Pavlik harness, our little demo doll. The packaging, now the reason I save the packaging here for you to look at, number one, there is a chart on most packaging, or if there's an insert in the package, and that measurement coincides with getting a measuring tape and measuring the circumference of the chest. That's how you can pick the proper size of Pavlik harness per the proper size infant. So we'll go on from there. When the doctor goes to apply the Pavlik harness, he is going to instruct the parents to apply the harness with the baby disrobed, only wearing a diaper. This particular doll has a thing here, so the baby, it doesn't present with just the diaper alone. But when you're applying the harness, the doctor, when the parents are applying the harness, you want to do it with the baby disrobed, only wearing the diaper. Now, in this particular case, you want to take the measuring tape and you want to measure across the nipple line. And in this particular case, the child is right at, I'll come in close, is right at 16 inches. So if you come over to the chart, pretty easy, right there. Preemie is 12 to 14 inches, so small, 14 to 16. Now this is important. If you have a baby that is right on the cusp, like that we're right at 16. And it says here that you can go to a medium from a 16 to 18. There are some schools of thought out there that if you're right at the cusp, in this particular case, say 16, instead of doing a small harness, which we have here, instead of doing a small, you can do a medium, because obviously the baby's going to grow very, very rapidly. So you'll have room to adjust as the time goes by, rather than starting with a small and then a few weeks later, when the parents come to follow up with the MD, they have to charge them for a whole nother Pavlik harness of a medium, and so on and so forth. So if this baby presents to you and she or he is right at 16 already, if the doctor sends you back to the supply closet and says, hey, the small, even though it measures for a small, I want to get a medium, you know exactly why he or she is doing that. So what we've got the infant here. I'm going to show you how we go ahead and open up the Pavlik harness. Some providers will ask you to prep this prior to the patient's arrival. Other providers, what they'll do is they'll have you leave it intact, and they'll show the parents from beginning to end how to take it off and put it on, and so on and so forth. So you undo the shoulder straps and you open them first. There'll always be a crisscross, like a backpack, on the back part of the patient. Then you open the chest strap, just like so. Then you remove, what I started to do prematurely, you remove the little feet couplets, because we're going to address these later. Those are the things you do last. Well, in this particular case, what the doctor would do last. So now you have your open Pavlik harness that you're going to place the baby in. And again, this main strap goes across the nipple line. So what you do is you line it up, and you should have the right measurement because we measured prior to getting to this stage. You bring it across just like so. Now don't get too crazy about fastening this, because you're going to have to revisit this in a few minutes. Make sure that it's at the nipple line, and most importantly, make sure that you have at least 2 fingers gap in there, nice and comfortably. Just like so. And then what we're going to do is we're going to fasten the shoulder harnesses, just like you would a backpack. Pretty simple. The main, again, this is why we said we're not going to get crazy on this yet, because we have to come back in here and get to this loop. Bring it in just like so. The main purpose of the shoulder straps is to keep the main belt at the nipple line. Next, we're going to go ahead and address the leg straps, the hip straps, and the little feet couplets. So what we'll go ahead and do now is we'll go ahead and apply the lower half of the harness, which is basically 2 little foot couplets here. They open up very, very easily, just like so. And there's where the little foot will go into. Red is always on the right. It's just the way, I don't have an explanation for that. That's just the way it's always been. It's an easy way to remember some parts of applying the harness, and the blue is always going to be on the left. So you just open up the little straps, and you kind of get it all ready, nice and neat. And then it doesn't matter which one you put on first. If you want to go with the right first, that's fine. You slide the foot in, and again, this is going to be a bare foot, no sock, into the little stockinette that's there, and then you're just going to fasten it. And again, you're going to fasten it normal, not too tight, just normal and comfortable. And at this point, if this was a live baby, they'd probably already start getting fussy at the fact that you're messing close to their feet, because their feet are so sensitive. Now this part's important, and we're going to do the same thing I'll go ahead and do this one too. We'll do them both at the same time. So that way, that's one less thing I have to do to be repetitive. There we go. So then a lot of times I was just asked, in between pausing for the recording, I was just asked, what's the main thing as far as putting on a Pavlik harness. The whole idea is that your ball and socket normally looks like this. Your acetabulum, your hip joint, normally looks like this in the normal everyday adult or pediatric patient. However, when you have hip dysplasia or underdevelopment, the acetabulum looks more like so. And when you're at rest, your ball and socket looks like this. But when they flex the knee, like so, you can actually see it happen, even on a doll. When you flex the knee, the ball goes deeper in to the socket. Now what's going to happen is this is entirely above my pay grade. The doctor is going to decide at which point, somewhere between 90 and 110, he or she wants to flex, and they're going to adjust the straps accordingly. And of course, then you're going to abduct to a natural, a neutral position. But again, that's their decision to make. But what ends up happening, the idea here is that as you flex the knee, it puts the ball into the socket deeper. And as it does that, and the hip wants to develop over the first 3 months, it'll start becoming, hopefully, a normal ball and socket presentation. I have seen where doctors have used this for like a femur fracture because the baby's so small. And there's some other reasons as well, but again, that's their call to make. You're just there to assist. You take the anterior strap and you place it into the anterior loop. Again, this initial application, where this is going to rest, is entirely dictated by the MD, not by you. So as you pull more, you get more flexion. And again, this strap is going to follow the axillary midline, so on and so forth. It's going to transition to the anterior medial. Then you take the posterior, and this helps maintain the abduction of the hip and the knee in a natural position, like so. And so what ends up happening is both will end up looking like so. And this is exactly how you would apply the lower half of the harness. And we'll do the same thing on this side real quickly, because there's a final stage I need to show you guys before we call an end to this video. And again, if this was a live baby, I'd be going much slower because the baby would be upset. And the more upset the baby gets, of course, the more upset the parents get. So you want to take your time and go step by step with the parents, since this is, a newborn and they're possibly new parents. And, you're doing some stuff here that's making the baby upset. And of course, you don't want to get them upset. One of the most important features towards the end of applying the harness is this, because what's going to happen is the MD is going to make marks where he or she ended each of the straps. And even this one, now that we're done applying all these, we can come over here and finish it all the way around. I'm going to be a little bit forceful there with the doll, but they're going to make a mark at the end of every single strap. And this is exactly so that you don't get that call, that triage call in the middle of the night when they're absent, or the doctor is on vacation and they can't take the call. You end up on the other end of the line, or you end up in the office setting or the ER setting, and you're dealing with a harness that you don't typically apply. I'm going to put a mark here and a mark here. The marks are generally made so the parents, if for whatever reason they take it off to bathe the baby, or the harness gets soiled, and then they go to reapply it after they've cleaned the harness, they know exactly where the mark is. They know where to go without having to call you. So that's the idea behind marking the harness. So this is your standard Pavlik harness on a newborn. Thank you very much.